Hello, everyone. This is Dr. Jeffrey Sweeney, and I'm here following up from Professor Peter van der Spek to talk to you more today about COVID-19 and specifically about the digital solution landscape. So learning from Professor Peter van der Spek about how COVID-19 can affect the body and basically how we're fighting a battle that's not going to be solved only on medical fronts, but also that we have to use technology in ways to find societal solutions and try to avoid that, too many people have unnecessary death or illness. So my focus today is to discuss the COVID-19 digital solution landscape. And I want to focus on how we can not simply look at the problems, but also how we can look at the opportunities. So how can we actually have a way to induce change in society using such technologies as what have been offered for the COVID-19 crisis. With that, I would like to begin by first introducing the basic structure of my story here. So first, I'd like to look back basically at the good, the bad, and the ugly. And what I say here is that there's basically three realities that we have that are going on at the same time. There's a good reality, a bad reality, and an ugly reality. So looking at those realities, what do we learn and how do we move forward? I would just like to add at this moment that at the end of the presentation, I can have questions. If you can place those questions in the comment box below on the screen. So the good reality, what is that? Well, the good reality is that if we have COVID-19 digital solutions that are available and they're working properly, that we have a way to turn personal individual information into public resources. And those public resources can be very valuable to solve complex problems in society. And so for one example, we have on the left, this is a COVID-19 symptom study out of the UK. This is driven by researchers, mostly medical doctors who had studies already underway. They repurposed that study in the apps to now figure out how can we track and detect COVID-19. And in doing that, they were able to detect hotspots in the UK and to learn how to support certain individuals in society, certain people who have pre-existing conditions. As we've learned from Professor Peter van der Spek, having pre-existing conditions is also a major issue. So knowing both what are the patterns of the viral spread, but also knowing the risk that individuals have with their pre-existing conditions is very valuable for society to then focus efforts. On the right, we have, if I can say it correctly, Aragoya Setu app out of India. This is more of a government-driven solution. And this was something that was rapidly built with volunteers. And they came up with a way of introducing technologies using many of the contact tracing technologies that we know, such as Bluetooth, to try to find out how is viral spread occurring, how can we trace that, but also to inform people, to educate them, to teach them how do you avoid contact with the virus in the first place. And so you can see with these two examples that there's this good reality that we can believe in and trust in, that digital solutions can actually help society. Now, moving to the more, let's say, the bad reality, as I call it, there have been many privacy issues that have come out of a lot of the digital solutions. So it's not privacy by design, it's more privacy as an afterthought. So you can see that, for example, in certain countries, that privacy was really not the main purpose here. The purpose was more of monitoring and controlling in a very rapid fashion. And some of these digital solutions have been shut down now because of that, for example, in Norway. On the right, you can see a source where it's showing just how bad this can be. So for one, solutions that are being developed in many different ways with many different technologies, each with their strengths and weaknesses. But for example, you can see that across 50 countries, that all the different tracking measures and all the different technologies lead to issues. So for example, some of the apps don't have privacy policies. Some don't disclose how long they would store data. Some don't actually show how they would protect your identity. And some even involve advertising type companies in the background to potentially track your behavior. Now, moving to the ugly reality. This is something that we've seen that's emerged during the COVID-19 crisis, almost a crisis, well, definitely a crisis alongside the crisis, that it's revealing how little trust there is in government. And in some cases, there's underlying reasons for that. So you can see the panel on the left here showing that, for example, individuals across 6 different countries find that scientists and doctors are trustworthy. But when you go down on this panel and you see here that politicians or the government are just not as trusted. And so that introduces definite problems with adoption of technologies, especially those that involve surveillance. On the right panel, you can see how that is reflected also in the type of technologies that are being introduced. So for traditional contact tracing, there's a high level of support. That's something coming from a trusted source, coming from a health organization, which on the left side is shown to be more trustworthy. But temperature checks and centralized quarantine and moving down the list into smartphones and electronic devices, thermal cameras, so on, down to CCTV cameras, and then finally down to your actual financial transactions, that there's much less trust, there's much less support. And that, of course, would lead to issues in adopting digital technologies. Looking further, you can see in the bottom panel on the right that this is not something that's homogeneous across demographic. So for those who are have lower socioeconomic status, for those in minority groups who have good reason to not always think that what's being done is in their best interest, they may not be as interested to adopt a technology. They may not believe that the technology would actually benefit them, that would be used for their good, their benefit, and not for the benefit of the government. So here you can see that there's some issues that need to be addressed, and not simply that we focus on only the technical problem of how do we trace or track individuals and the spread of the virus, but how do we actually regain the trust of members of society? So it's more of a societal issue than a technical issue in many cases. So looking back at the good, bad, and ugly, what do we learn? Well, first we learned that the COVID-19 digital solution landscape is fragmented across many different solutions, many different countries, and that leads to lots of technical issues and later down the line with respect to aggregating data, with respect to actually producing data that's for societal good. Then we have the problem that most solutions don't sufficiently protect privacy, and they could even violate human rights. And that's where hopefully new emerging solutions will do better, but that's an area that requires attention. Finally, more attention should be placed on the behavioral and procedural components. In many cases, the technologies that have been offered are really technology first and procedure and behavior second. And that can lead to adoption problems. So what we're doing in our projects within Erasmus University at RSM, we're tracking this, we're learning from this, and we're trying to organize the problem into a way that we can actually move forward. So what we learn is that by taking a framework, in this case, this is a framework based on information. It's an information framework. And we see that there are 3 main processes that are really happening between all the digital solutions here. One process is detection, the second is prevention, and the third is tracing. And those 3 processes interact with each other, or should interact with each other, in a way that then leads to a greater whole from the sum of the parts. There are 3 types of data that relate to each of these processes. With respect to detection, it's mostly about health data. What is your personal health, and where can you, what is your risk, basically, of infection? With prevention, that's more related to location data. And for tracing, it's related to social interaction. How many times are you interacting with other individuals? So this is a framework that we built to help to organize the problem and also to try to work towards what's a better solution here. I'm going to step through each of these shortly and give examples of past research as to giving examples of how each of these three processes play a role, but also trying to look into the question of how can we use these processes moving forward? How can we use these solutions moving forward to actually empower individuals rather than only use the data for the current situation in more of an aggregate sense? So with respect to detection is basically assessing individual health metrics to determine the risk of exposure to SARS-CoV-2. So if I give an example of that, going back to the study from the UK, we have here basically the overall function of their solution is to keep a finger on the collective pulse. And they do that through symptom tracking and syndromic mapping. Here you can see different symptoms that are spread across the UK, where you end up with different symptoms that are affected people differently. And what that leads you to understand is that over time, they can begin to not only track where hotspots are, but they can also look at the causes of potential COVID-19 positive cases. So what they came out of with this study is that they built a proof of concept, and they took those pre-existing solutions that they were using in other studies, and they were able to then collect data and actually come up with conclusions as to what was causing COVID-19, or what are symptoms, I should say, that are indicative of COVID-19. So to detect COVID-19 before it happens based on the symptoms. And so in this case, they show that, for example, lack of sense, the effect on your sense of taste and smell would actually indicate before you know you have COVID-19 that you are likely to have this. So you can imagine that using this information on a collective level is very helpful, but it's also helpful to use this information to inform individuals of how they can know when they may be at greater risk of infection. Second, we have prevention. So this is to do with assessing your individual location to avoid contact with the virus. The example here comes out of a study where they collected lots of information about point of sale and location information from phones. And they looked at the actual density of how many people went to each different type of establishment. And what they found is that during the lockdown period, that some of these establishments, which reduced in their actual attendance and the density, were ones that were actually valuable to society, that they might have better stayed open. They might have better found better ways to allow people to come, for example, colleges and universities, where the attendance decreased when maybe they could have found better ways to avoid that. On the other hand, you have situations where liquor stores, it's arguable about hardware stores, but some cases where, such as sporting goods stores, were still having high traffic, more than actually may have been necessary. So the takeaway from this is that we can use this type of information if it's protected and that it's not violating privacy, to prevent exposure, to warn people when is a location too dense, when are there too many people attending a certain location. And it can also inform policy. So basically, which places should be open first, which are more vital to be open, and so on. Third, we have tracing. Tracing is the more common process that everyone's aware of. This is where most of the digital solutions are focused. And that's about assessing the individual social metrics and try to reduce the risk of further transmission. So if you look on the left here, we see that traditional contact tracing works well under normal conditions, and it follows an ordered process to identify patients, follow up with them to learn who have they made contact with, identify those contacts and notify those contacts, and follow up through an ongoing process. And it's a race against time, because basically as soon as one person's infected, the index patient, and they start to spread the virus to others, it's only a matter of time before they can continue to spread. So it's a race to stop that spread when someone is infected. So it's a very reactive process. There's only about 7 days that people have to actually stop the spread when someone is infected and contagious. And so the question we can ask here is, looking at this traditional process, how can we use a digital environment to actually enhance that process? Where does it make the most sense? This is not a process that occurs automatically. It's a human process, and it involves many different people, and it involves many different handovers of information. There are issues where things can go wrong if there's not enough access to testing, if you don't have accredited healthcare participants, if you don't have an authority in the loop to actually intervene if there are false positives or if people are trying to game the system. Also, imagine that if you're someone who cannot afford to be self-isolated and stop their work, how are you going to react if you're told that you are now having to self-isolate? So there are many circumstances where individuals, although they're supposed to self-isolate, may not actually do that. If we look on the right side, the right panel, we can see that there is some evidence, there are models shown in simulations that under ideal conditions, it is possible to actually reduce R and get below the R naught of 1. So for example, here in this panel, you can see that social distancing, the yellow representing the mean, it lies above 1 when you're only social distancing. But if you start to add in some of these digital solutions and reduce the actual time it takes to then contact individuals and tell them that they need to take action, they need to get tested, they need to self-isolate, then it's possible to reduce R naught below 1. And so there is that benefit that these technologies provide. However, it is important to note that that requires a certain amount of adoption, and it requires that people actually follow the procedure, which, as we know, looking at the news across the world, that's not always the case. So finally, to summarize what we learn here, basically what we learn is that there are many questions that remain unanswered. Mainly, how do we integrate the flows of information when we have a situation where we have many different apps doing many different things, and that we have many issues to do with adoption? So there's this overarching research question as to how do we enable integrated flows of timely, granular, and actionable information to detect, prevent, and trace risk of infection. And to do that in a way that's not simply, let's say, controlling, monitoring people, but giving them something that's valuable, protecting their privacy, coming up with equitable solutions, and actually empowering people. So essentially, privacy by design, but also human rights by design. And we can ask the question, what are the barriers to this approach? To actually try to focus on the individual. What is the role of the individual in adopting and accepting behavioral change? And what information do individuals need to make better choices during uncertain times? So moving forward, we feel that there's more information needed and more research needed to get to the bottom of these problems. It's a large problem to solve, and it doesn't just happen by pushing technology out the door. So we need to find better ways to, first of all, detect if a person is infected with COVID-19, or if they're at risk of infection, through mechanisms such as self-assessment, monitoring, remote assistance, precision testing. To prevent transmission through mechanisms such as self-isolation, protective measures, avoidance of risk, creating safe places and safe paths or times for social and economic interaction, and to trace the sources of the virus and manage personal contact through mechanisms such as personal diaries, self-tracing, trusted group tracing, and identification of super spreading events and super spreading locations. To do that, we suggest, based on our research, that we can start by building a framework. You can almost think of it as a value chain, where you have the three processes, detection, prevention, and tracing, that sit on top of supporting processes. Those supporting processes would be to first identify who are individuals using an app, are they who they say they are so that they can't game the system, to prompt those individuals with valuable information and ask for their response, and to ask that they provide informed consent to share their information, and to create a dialogue so that basically using a digital solution, using a technology, a platform, connecting apps with scientific data, that we can provide value to individuals in a way that they are comfortable and that benefits them. So this is an example of our vision. Here's one scenario. You can imagine that if you're equipped with a phone and a ring, that you can, with this ring and with this phone, be able to provide information that is valuable to understand and detect what your health is. So this ring, for example, here is one that we're using in our research, and it tracks, for example, your heart rate variability, and your temperature, as among other aspects. Coupled with the phone, you can then track location. And if individuals want to opt in and be part of a research project to come up with better solutions, then they can take part and have access to more information. So long-term vision would be to be able to use a biometric wearable device, use a mobile device, and then support people in self-monitoring their health and self-tracing their behavior, and to ultimately reduce transmission. So for example, you can see here that we would encourage people to stay home if they have certain symptoms that are apparent. We could then ask them to turn on tracing and protect others and show where they are in society, and then allow more aggregated information, anonymized information, to be collected. And then to give them prompts and information to tell them when they're doing, when their behavior is desirable and when maybe their behavior puts others at risk. Second, the other vision we have would be a different use case where someone who only has a phone would be able to then benefit from the information that's gathered by detecting in a small number of individuals who have wearable devices what's actually happening, looking at what are the actual state of affairs with viral infection and density and other aspects like that. So you can imagine that if you're equipped with information based on where you are currently located, where you should avoid going. For example, this is the campus at RSM. In this scenario, the library is overcrowded and the advice is to take a different route. So this is a safe path towards a classroom, for example. Also, being able to have information and share information with others in a trusted network, family members, and be able to encourage each other, whether they're taking too much risk or their behavior may not be optimal, to be able to have that kind of social influence over each other. And finally, to be given information, again, about good behavior and be rewarded in some ways, to be made aware of how are you actually lowering your risk of infection through, for example, an infection score. So to move towards this vision, what we are doing is we're setting up a project, Rapid Prediction and Response System project. So RPARS for short. As part of the project, we're building a research platform and we're setting up a prototype environment. And the idea is to design and examine behavioral interventions. We've set up a secure app environment and a secure server. And we've configured health and location sensors using wearable device and using the app itself to be able to gather this type of information to then be able to look at what interventions would actually influence which behaviors. So following the what I call the value chain here with the 3 processes and the supporting processes, we have set up a dynamic messaging system that would deliver different types of information to see which information and which types of messages would have optimal response. And in the future, we would plan to integrate with external data sources to start to pull in some of the information, for example, that Professor Peter van der Spek spoke of, to better understand where risk comes from. And then use that in a risk assessment system and start to build models to simulate certain scenarios. And so have a complete research environment to take the research lab to the individual rather than the individual to the research lab. And with such an environment, we could address different research questions. We can start to ask questions about how can we remotely support and self-monitor and self-isolation in an equitable manner. We can empower people to make better health choices. We can begin to examine behavioral interventions to see which are most effective. And we can start to measure and predict health risk. And we can determine over time what are the cultural, social, and structural barriers to enacting positive change. And finally, we can further empower members of vulnerable communities and try to learn how we can do that with the use of digital solutions. So in my last slide, just to kind of wrap up the whole story, I realize it's a lot of information, but hopefully that was well received. Looking back, the good, bad, and ugly realities. So the conclusion that I would like to say here is that we need to maximize the good, minimize the bad, and change the ugly. What do we learn? Well, we learn that there are many unanswered questions and research is needed. So we have to get to work. How do we move forward? Well, we need to enact social change. We need to do this inclusively, carefully, and quickly. Finally, questions or feedback, please, in the few minutes we have left, submit those below. Otherwise, you can send those to me in an email. I want to thank everyone for attending. I really appreciate it, and I really appreciate your time.
Yes, I would like to thank Mr. Sweeney as well, Dr. Sweeney, for this very insightful presentation. If anyone has a question, please leave them in the live chat and we can submit those to Dr. Sweeney. So far, we have not gotten any questions, but I do have a question for you, Dr. Sweeney.
Yes.
How do you feel about governments such as the Chinese government implementing apps and other digital solutions that might violate privacy rights?
I feel it's not sustainable, at least not in other parts of the world. And so I think that, that's just evidence for why more research is needed to come up with better ways and better approaches. And there's even signs that it's not that effective because sorry, there's some background talk there. So it's not necessarily more effective because they still have outbreaks that occur. So it takes participation of the individuals and it takes participation of government together.
Perfect. Thank you for your time and thank you for the great presentation. I hope everyone enjoyed today's presentation by Dr. Sweeney.
Okay, thank you.